Hi everyone, this is Ashley and I'm going to make a video on how to take a home pregnancy test. So I have three different types of tests that are very typical. We have a cassette test, a midstream test, and of course a test strip, which is also known as an internet chibi. So before I proceed, I'm going to go ahead and show you the different types of tests that we have. This is a First Signal. It's a test at Walmart. It's about 88 cents. It's very inexpensive, and this is it's known as a cassette test. And what you do is you take a dropper, and you take the dropper and you drop the urine, about 4 to 5 drops in here. Test strip. These are actually very inexpensive. You can get these on Amazon, eBay. You can get them actually in big bundles. If you like to pee on a stick frequently, this is actually the most inexpensive way to do it. You can take this and dip this in the urine, and I'll show you how to do that in just a minute. And then we also have the most common, which is a midstream test, which is this right here. And we're going to use Clear Blue Easy. So I have 2 pink dye tests and I have 1 blue dye test. And I also have 2 urine samples. So as I do each of these tests, I'm going to show you exactly how they work. So we'll go ahead and start with the test strip right here. If you get these, this is the way it kind of works. If you have what is known as HCG, or human chorionic gonadotropin, that is the hormone that is secreted once implantation has occurred, or implantation, which is when the fertilized egg actually burrows into the uterus lining. It secretes that hormone, and then after a couple of days, you typically have enough in your system to yield a positive result. Now, it depends on how sensitive the tests are. You know, you have tests that range anywhere from 10 MIU, which are test strips, or even first response, which is a pink dye test, which first response, I believe, is about 6.5 MIU or MLU. And you have dollar store tests, and even this First Signal Walmart test. It's about 88 cents, and that's about 50 MLU. So you need kind of a higher concentration of the HCG hormone. So it's recommended in early pregnancy probably to test with a higher sensitivity test. These can be anywhere from 10 to 25 MLU. This is about 50 MLU. And Clear Blue Easy, I believe, is also about 25 to 50 MLU, but I think it's about 50 MLU. So with that being said, let's go ahead and get started. I have 2 urine samples here. This one right here contains HCG, and this is a normal urine sample. So we're going to test both of these. I'm going to do the pink dye test with the HCG urine, and I'm going to do the blue dye test with the normal urine. So we'll go ahead and start with a test strip. Now, the way a test strip works, 2 lines yield a positive no matter how faint that positive line is. The control line indicates that the test is working properly. The test line indicates that there is a presence of HCG. And basically what happens is the HCG has a reaction with the antibody strip, the chemicals that are on that, and what it's going to do is, as the dye runs across the test, it causes the test line to turn a pink color, or even a blue, depending on what kind of test you're using, if the hormone is present at the time. And you want to do this within a 10-minute strict window. So we're at 4.5 minutes. Now, I highly recommend holding the test strip or midstream test, or even, it's usually midstream or anything that requires you holding it in the urine for at least 10 to 15 seconds, or at least 5 to 10 seconds, actually, should I say, because you don't want to undersaturate the test, because if you undersaturate the test, you're not going to yield any result. And you also want to avoid dipping it. You see where it says the max line right here. You want to avoid dipping it over that max line to avoid oversaturation of the test. So here we go. So I'm going to dip this for probably about 10 seconds. Actually, I did about 15 seconds. I think I'm thinking I want to hold them in the urine about the same time. So that is a test strip, and that's how you would do that. You dip that in, you don't dip it past the max line, and then the dye is going to run across it, and the control line is going to indicate that the test is working properly, and if the HCG is detected, the dye is going to, or the HCG, essentially is going to cause the antibody strip to react to that. And it's going to turn whatever color the dye is that runs across the test. So we'll get to that in a minute. And as you can see, there's the control line working already. The next thing we're going to do is we're going to dip. This is a cassette test, and it has a dropper just like this. And we are going to dip about 5 drops of urine into this area right here, and then the dye is going to run across. This is the test line, this is the control line. The control line again is going to suggest that the test is working properly, and then if HCG is detected, it's going to work the same way with the test strip. It's going to react to the antibody strip, and then it's going to turn color if HCG is presented. And of course you want to do this within the strict 10-minute window. Any line that is outside of the 10-minute window, regardless of what color, would be considered an evaporation line, and you want to go ahead and discard that. So let's go ahead and do that, and I'm going to dip it and do about 5 drops, and that's how you do it. You do, let's see, 1, 2, 3, 4, and 5. Okay. And you just discard that. Okay. And then and this is also by, just so you know, this is a concentrated urine sample. This has been held at least 2 to 4 hours. Abstaining from beverages. You want to stay away from coffee, tea, water, soda, and all that good stuff. So it has the highest concentration of HCG in it. You typically with, oh, look at that. Wow. That's almost instant. Wow. Okay. Typically you want to use first morning urine, with these tests because it has the highest concentration of HCG in it. Oh my goodness, wow. Okay. That is very positive, and that's within a matter of seconds, and this is a 50 mLU test. Okay, so thirdly, we have the midstream test. Now, you can hold this in your urine stream, or you can dip this in a cup. I usually opt to use the cup of urine because if I look at it and it's not highly concentrated, I can throw it out and then try again later, so I'm not wasting a test. So I'm going to go ahead and I'm going to use this one. This is in the normal urine, so this should not yield a positive result. So I'm going to hold this in for about 10 to 15 seconds. Actually going to put this, there we go, cut back on it. And the urine's going to run through it, the dye's going to run through it. this would be the control line, that's going to be the test line, and if it's a positive result, you're going to see a plus sign. That came up with an immediate result, and as you can see right here, that is also a very positive, there we go. That is also a positive result as well. Now just keep in mind that when doing pregnancy tests, even if you have a light line like this, that is still a positive result. If it comes up within the 10-minute window, that is a true positive, especially if it has color. Now, if it comes up after the 10-minute point, you normally want to disregard that and you want to test again, because that's usually considered to be an evaporation line, and that's when the urine actually dries on the test. And a line where the HCG would have caused a color would appear had it detected the HCG within that normal 10-minute window. So you want to discard that. If it's pink and it's within the 10 minutes, no matter how faint that is a true positive. So every couple of days, your HCG levels are going to double. So I highly recommend, you can use a digital, which will say a clear yes or no, or you're pregnant. Some will even give you how many weeks along you are. And also, even with a first response or other tests, your test line is typically going to get darker as the HCG increases in your bloodstream and in your urine. So every couple of days, it's good to test. So that way, in case you have any doubts about it, you can test again, say 2 days later. And if you get another line within that 10-minute window, you're pregnant. So it's time to go ahead and make an appointment with your OBGYN and get a blood test done, have them do a urine test, and they can even do an ultrasound to confirm how far along you are and, if your levels have doubled or whatnot. It's not uncommon to have a chemical pregnancy, which is essentially an early miscarriage or even a miscarriage, which sometimes typically with a period, we think, oh, it's a normal period. And sometimes it can be an early miscarriage. So if you test, like if you do charting, like your fertility charting, where you're doing basal body temperature, you're doing cervical mucus or cervical fluid, and also cervical position, 7 to 10 days past ovulation, sometimes we typically want to test, and you can get a very faint positive line that can start to get darker and then start to get lighter. So that might be an indication of that. So I would always highly recommend that you make an appointment with your doctor, your primary care physician or OBGYN, and get your levels checked just to make sure, because it's not uncommon, and unfortunately there's nothing we can really do about it. It's one of those things where it's actually more common than not, and there's really nothing you can do to prevent it. But I would highly suggest keep trying, keep your hopes up. It's going to happen one day. I went through about 10 years of infertility, and I tell you what, it was very heartbreaking. But guess what? I had 2 babies. It happened finally. And I'm even considering having a third at some point, not any time right now, but maybe in the future, maybe the near future. But that's what, we have. There's all kinds of fertility treatments. There's tests you can take. There's male factors. There's all kinds of stuff that can help you and aid you. And also, we have a support group. It's called Pee on a Stick Freaks. It's on Facebook, and it's a trying to conceive and informational support group. I highly suggest joining. We have some terrific ladies there, and we're here to help you. So with that being said, as you can see, this is a positive result on a test strip. I'm trying to get my camera to focus in right there. definitely very, very positive result on the Walmart test. And it should be a negative result on the Clear Blue Easy. There we go. And that's with normal urine. Alrighty. Okay, so there you have it. So that's how you would take a home pregnancy test. And cassette, midstream, and test strip. And those are the three common forms of pregnancy tests. You know, HCG, what a positive looks like, pink dye, test strip, and cassette, because these are very common. And then, of course, the negative result with normal urine on a midstream, blue dye, because they are also very common. Not as common as pink dye, but we do have them. People do take them, so there you go. I do highly recommend to do a pink dye test whenever you can, but I just wanted to show you how all three can yield the results they're supposed to, depending on what kind of, you know, concentration and typical dyes and normal versus HCG. So that's what it would look like. This is Ashley. Do me a favor if this video has been informative, and if you've found it educational and you've enjoyed watching it, do us a favor and give it a like and subscribe to our channel and share the information. That's why we make these videos. Follow us on Facebook and Twitter and Instagram. We have Instagram, pianostickfreak.com, Twitter, pianostickfrk for freak, and then also Facebook, Facebook, pianostick freak. And we also have videos, and we have experiments and contests, and even a home pregnancy test gallery that has evaporation lines, pink dye and blue dye positives, digitals, and we're actually going to do some dye runs and all that good stuff on www.pianostickfreak.com. So if you get a chance, check that out. We update our content often, so visit daily, and you could win some free home pregnancy tests and OPKs. Share this information, and again, if you like this video, do me a favor and give it a like and subscribe to our channel, because that would be appreciated. And I will definitely make some more videos down the line. So this is Ashley. I hope you're having a good Christmas and a happy New Year. We send out lots of baby dust and sticky vibes. And if you have any home pregnancy tests that you would like to submit, email them to us, direct message them to us on Twitter, Facebook. You know, you can also post them, and we'd love to add them to our gallery. We're also accepting charts, fertility charts. So if you have any completed charts, you know, just let us know what kind of medications you were on. Was it ovulatory, anovulatory, pregnancy? You know, did you take any fertility aids, supplements, Clomid? You know, was it IVF, IUI? Any of that good stuff. And how old you are, how many months you've been trying to conceive. And email those to us as well, because we're going to start a basal body temping charting gallery as well. So we'd love to have those. Again, this is Ashley. Y'all have a wonderful evening. Have a Merry Christmas. Have a Happy New Year. I am sending out baby dust for those big fat positive Christmas home pregnancy tests, and Happy New Year's. So again, visit us on www.pianostickfreak.com.